Manuel Lluberas. I'm the Executive Director for Public Health for HD Hudson Manufacturing Company. I've been involved in the implementation, in the design and implementation of malaria vector control programs in something around 31 countries in the last 17, almost 18 years. I was an avian entomologist before that for another 12, 13 years. Any resolution, anything that has to do with mosquito control that is decided here in the United States have repercussions around the world, simply because many countries outside the US and outside many countries in Europe do not have the equivalent of an EPA or a USDA for that matter. So they look into the United States to see what is happening in the United States and parts of Europe, and they apply that information on those resolutions and those directives into their programs. So anything that affects mosquito control in general, and keeping in mind that the current malaria rates for malaria mortality as of last year, 2011, is in the neighborhood of the equivalent to 13 747s crashing every day. Okay? The World Health Organization and some other people estimate that the mortality for malaria is roughly around one person every 33 seconds. And that person is usually a child under 5. So anything that happens in this country, any directives that is being produced that affects mosquito control in general, will have a repercussion around the world, because the world, the countries like Botswana, Zambia, Zimbabwe, Malawi, you name it, that do not have an EPA, will look into what happens in the United States and apply those decisions into their own campaigns. And if we limit mosquito control here, there is a good chance that mosquito control, the way we understand it in parts of Africa, will cease to exist. And even with mosquito control the way it is now, we have a 33 or 34, one every 33 or 34 seconds someone dies. Imagine what it would be if we did not have mosquito control.